Okay, so welcome back to the YouTube channel. Now we're doing lower extremity, so we're going to start with the hips, and now we're just doing the observation aspect of it. So I'm going to ask the patient to stand, and I'm looking to see if the hip is flexed. It doesn't seem to be any flexion. I'm looking to see if there's any external rotation at the hip, and there is not. And then you look to see if there's any weight bearing more on one side than the other, and there doesn't seem to be that either. Okay, and you look for any swelling or bruising. Normally, the only place you would really be able to see it would be on the greater trochanter, the trochanteric bursa. Okay, and now you ask the patient to go on their back. So we're going to do active ranges of motion for the hip. The first thing you want to do is you want to palpate the PSIS, and you want to put your hand underneath. Okay, so you're going to bend the knee of the patient. You're going to put them in adduction, and then you're going to find the pieces, which is right here, and then you're going to bring them back. Okay, and now you're going to ask the patient to just put their knee back down. And now your hand is underneath the patient, okay? Then you tell the patient to bend their knee, okay? And your hand is just here to guide. And you're gonna ask the patient to bring her knee to the chest. And you're just guiding to make sure that the knee doesn't go side to side, okay? And you go. And at this point, I start feeling the PSIS dig into my fingers, so I know I've reached maximal hip flexion, because I don't want any other compensatory movements, okay? So now we're going to do hip internal and external rotation. So for external rotation, you're going to ask the patient to bring her toes downward, but you want the patient to just move her knee like this, okay? So can you, and you're going to put your hand here to guide the movement. You're not doing it yourself, okay? Can you bring your toes that way? Any pain? And then you come here, you put the knee against your body, and you turn a little bit. Any pain? Okay, that was external rotation of the hip. And now you can ask the patient to do the other way, so can you bring your feet that way? Any pain? Same thing. Any pain? And you're looking for that capsular end feel at all times, okay? So now we're going to do hip abduction. You're going to place your hands on the opposite side of the hip to stabilize this part, and we're going to work on this leg. You're going to place your hand just above the ankle joint, and you're going to ask the patient to bring their leg out. And you're going to go until you start feeling movement right here. And then that's when you know you've reached the maximum. And you can put slight overpressure. Any pain?
On the hamstring.
So now we're going to do hip adduction. I'm just going to ask the patient to bring their leg like this. Okay. And then you're going to ask the patient to bring their leg inwards. Okay. And then once you start feeling that it gets like, it starts pushing up into your hand, that's when you know you've reached maximum adduction for the patient, and you can put slight overpressure.
So put your hand here instead.
Any pain?
No, grab me.
We're going to do hip extension. Okay, to do this, you're going to first ask the patient to bring your leg up as high as you can, and you're just going to see how they do it. Okay, and you see how the hip goes off the plinth. If you come on this side, do it one more time. You can see that it starts to come off a little bit, okay? So what you're going to do as the PT, the professional PT that you are, you're going to put pressure here with the PSISs, and you're going to ask the patient to do it again. And she gets less movement, which makes sense. And then you can put slight overpressure. Any pain with that? Okay. So now we're going to do passive range of motion for the same movements we just did. So put your hand underneath the PSIS.
Lift your leg as far as you can.
Okay, like we showed earlier in the video. And then you're going to place your hand underneath. Okay, you're going to get a good basic support. And then you're just going to tell the patient, just relax, be chill, be cool, alright? You don't want the patient to tense up at all. And you're going to guide the movement till you start feeling that it buckles up.
That much. Not like you whip.
And there we go.
Right.
And then you come back. And there's no overpressure for this either.
See, there
wrong for hip internal and external rotation. You're gonna make sure the patient is close enough to you. Okay, you want them to almost touch your body, and then you're gonna ask them to relax completely. Okay, you're gonna bring their leg into hip flexion, their knee into 90 degrees flexion as well. You're gonna put your hand underneath, wrap around. You get a nice grip. And now I'm gonna do hip external rotation. I'm gonna turn this way. Turn. Any pain? Okay, and remember that you're doing the movement, not the patient. And then I'm gonna turn the other way. And I'm turning this way. Any pain? And that was for hip internal rotation when I'm turning it this way. Passive range of motion of hip abduction and adduction.
Sorry.
So you're gonna place your hand again opposite to the hip. You're gonna support the leg, and you want to stop until once you feel that the hip wants to lift. That's when you know you've reached end range. Okay.
Okay.
So you're gonna stabilize here, and you're gonna follow the plane. And you're gonna, like this, and there we go. That's the most I can get. Okay. And for adduction, you're gonna ask the patient to bring her leg out like this. You're gonna stabilize on the same side. You're gonna put some pressure, but be careful because it's a bit sensitive. Okay. Any pain? Okay. And then the same concept. You're gonna push.
For external PROM.
And that's as much as I get. Any pain with that? Now we're gonna do PROM of hip extension. So again, you're gonna stabilize over here. And you get a nice grip. You can have the knee bent like this. You're gonna go underneath the knee.
Not just
So this way.
or else you'll tire yourself out.
Okay. And then you're gonna go up.
It's hard because you keep your one hand here.
Any pain? And then back. You go up.
Do you feel like I'm bringing
Right before the hip starts to lift. You okay? See, if I go any hard, the hip lifts. Go up,
Like, can I just do a
and that should be end range.
Sure.
Rise onto the hip, send movements again. So we're going to start off with hip flexion. We're going to ask the patient to come in 90-degree hip flexion. The knees 90 degrees.
You want to move on?
You're going to place your hands like this. Okay, you're going to have your feet pointed this way. So come on this side, please, so you can see better.
Oh, I'm so sorry for calling.
You're going to have this position
That was so funny. I was blind.
like this. You're going to tell the patient, don't move. Ready?
That was funny.
Go. 1, 2, 3, 4, 5. Any pain with that? Now you were resisting hip flexion by pushing an extension. And now I'm gonna push an extension.
I feel like after practice,
Same thing.
dude, this is exactly.
And I'm gonna go this way. And I'm gonna push this way.
I find like
Hold this.
not necessarily for this, but I find at a point of plateau.
So now we're gonna do rise arm for hip abduction and adduction. You're gonna keep the patient neutral. And you're gonna go above the knee joint. Okay? And you wanna go until just before the patient starts to move. If the patient moves, you're overdoing it. See, that's it, that's the end. That was for hip abduction. For hip adduction, I'm gonna put my hands on the opposite side and I'm gonna push towards me. You ready? Don't let me move you. There we go. Any pain with that? So now we're gonna do hip internal and external rotation. You're gonna put the patient's hip in 90 degrees. You're gonna put your hands here. You're gonna tell the patient to relax. Completely relax. You don't want to feel the hamstring tendons pop into your fingers, okay? You don't want them to be taut. Okay? You're gonna get a nice grip. You want to squeeze, not too tight, but you want to get a nice grip. And then if you want to go, if you're pushing this way, you're resisting internal rotation. Okay, so if I'm pushing the hip in external, the patient wants to push back in internal. Okay, so don't move you. 2, 3, 4, 5. Any pain? Okay, that was resisting internal, and now we're going to resist external by pushing an internal. Don't move you. 1, 2, 3, 4, 5. Any pain? Okay, so now we're at the palpation portion of this video. So we're gonna try to find the greater trochanter. First, you're gonna ask the patient to internally and externally rotate the foot. So just to move the leg back and forth like this. And then you should feel a bone that keeps popping into your fingers in and out. That would be the greater trochanter. Okay. Now we're gonna go for the ischial tuberosity. This is a little bit more of an intimate part of the human body. So you ask the patient, I'm gonna be palpating the structure on your buttocks. Is that okay? So then, ischial tuberosity, you come here, and then you go until you feel a bone. And you have to be careful because it's sensitive for the patient. Now, you need to do it on both sides, so you use your thumbs because you need to see if they're level. So you come down, and then you go right here. Okay? Okay. So now we're going to palpate the belly of gluteus maximus muscle. You're going to ask the patient to bend her knee a little bit. You're going to place your hand right here. And can you just lift your leg up? And you feel the muscle pop into your fingers. Use your hand right here, okay? One more time. Up, down, up. There we go. Okay. So now we'll be palpating the hamstring muscles. So the hamstring muscles originate at the ischial tuberosity, which we already palpated. So we're going to go again, find the ischial tuberosity. Okay, so you're going to ask the patient to bring their leg into a slight knee flexion. And then we're going to start off medial. So you start palpating the belly of the hamstring medial. Okay, and then you should start to feel tendon. Okay. So this would be the semitendinosus. And right underneath you feel like a floor. That would be the semimembranosus muscle. And you follow it all the way to the pes anserinus, to the anterior surface of the tibia. Okay? And you maintain this position. Are you okay? Okay, you find the ischial tuberosity again, and then you go lateral. So now you're going down the biceps femoris muscle, and you're looking for any nodes or nodules, anything that feels different than the muscle belly itself. And I hit the tendon right here. And then I continue and I palpate all the way till I'm at the head of the fibula. Okay? Going to be palpating the muscles of the quadriceps. So what you can do is you can place a towel underneath the patient's knee joint, and that gives them proprioception. And then you're going to find the ASIS, kneecap, and you're going to ask the patient to press against the towel. Press against the towel. And now they're contracting, and then you can really feel the bulk of the rectus femoris. And then you can feel the bulk of the vastus medialis right here. And then press against the towel again, and then you can feel the bulk of the vastus lateralis muscle.